Our human doctors, so-called, get 89.5 as an average score. The Ask Bob, our AI machine doctor, got 92.4. Congratulations. For both the average score and then the stratified itemized scores, the human doctors and Ask Bob are quite close. And there's no big structurally disparities. So they are very similar in each category of these itemized scores.
Thank you, Professor Ji. Now let's invite Dr. Guo Tongxie to announce the champion of human doctors.
Okay, so I also have some good news to share. So today we have two winners of the best human player today. One is Dr. Natalia from University of São Paulo, Brazil. And another one is Xiangqing Wang from Peking University People's Hospital. Actually, I checked the data. These two players, they have average score above 90. So considering the complexity of these cases, that's really impressive results. Congratulations.
Congratulations to Natalia and Xiangqing Wang. Congratulations. So now we have already know the exciting results, and we can see that actually XBOB has matches the capability and to some extent have exceed the capability in diabetes management with human doctors. So now it's my great honor to invite Dr. Guo Tongxie to give a summary speech. And Guo Tongxie is also the colleague of Ask Bob.
So it's really a pleasure to be here today to witness the interesting competition between Ask Bob and human competitors. So as one researcher working on Ask Bob for years, so I'm really excited to see that the diagnosis and the treatment capability of Ask Bob reaches the similar level of human doctors. So I don't want to see AI win or beat human doctors because healthcare AI still has a long way to go. So considering the complexity of human bodies in real clinical settings, healthcare AI today is still better, from my view, better positioned as a tool to help doctors to make fewer mistakes or save more time. So in Peking group, actually, Ask Bob is developed as a more like a navigation system for doctors to provide personalized treatment or diagnosis recommendations at the point of care. So Ask Bob actually reads 500 million medical records, 14 million medical literatures, 200,000 drug instructions, and 20,000 clinical guidelines to build its internal medical knowledge graph and deep learning models. However, Ask Bob is not an autopilot system, and still human doctors make the final decision. So in the past few years, so far, over 1 million doctors and 40,000 hospitals are using Ask Bob every day. So it generates over 200,000 recommendations every day to help doctors to make better diagnosis and treatment at the point of care. So as a researcher, and I'm really excited to see that Ask Bob is helping doctors and patients, especially those in rural areas, to get more accurate diagnosis and treatment. Again, healthcare AI, still a long journey, and I look forward to work with medical experts like you to develop better technologies to help more people in the future. Thank you.
Thank you, Dr. Xie. And now let's welcome Professor Linong Ji to the stage and give us a summary speech.
First, I'd like to thank International Diabetes Federation, Peking University People's Hospital, Peking University International Hospital, and Peking Group for sponsoring and organize such a quite unique and marvelous symposium on AI and diabetes. So this competition it's the first part of the symposium, and following that, we'll have lectures and panel discussions. I think these events marking a new journey for us to conquering diabetes. I've been working with Dr. Zhou in the past 12 years. Xian Tong, since he, at that time, he was working for IBM. We're working together in our hospital, trying to develop a clinical decision system for diabetes. And in the past 12 years, and the field is moving so quickly. And I cannot believe that what we have achieved 12 years ago and now is totally different. Thanks for the modern technology of AI and also the big data and the way we can handling such a vast amount of data, guidelines, literatures, and put them all together to achieve these achievements that we witness today. I think in the future, as Professor Bolton had stated in his opening remarks, AI has a promising future. I think we should work together with Mr. Axel Bob and then to integrate the human doctor clinical practice with Axel Bob practice, and then we'll bring the more comprehensive, more individualized diabetes care, and more importantly, more warm diabetes care to our dear patients. Thank you all very much for all the participate for the competition, and thank all the judges for your input and for your hard work on preparing such events. Have a good time in virtual IDF Congress. Thank you.
Okay, now our competition has come to a very successful end. Please allow me to say thanks to all of you for your participation. And now may I ask all of you to come to the stage and let's take a group photo.